Bismillahirrahmanirrahim. I am Dr. Ammad Waheed Khan, PG Community Medicine Department, King Edward Medical University. My supervisor is Professor Dr. Saira Afzal. Today, the topic of presentation is antenatal care. Learning outlines, introduction, objectives, antenatal visits, antenatal checkups, warning signs, specific protection, recent updates, and MCQs. Learning objective. At the end of the presentation, the participants will be able to describe the objective essential components and the need for better antenatal period. Antenatal care is the care of the woman during pregnancy. The primary aim of antenatal care is to achieve at the end of the pregnancy a healthy mother and a healthy baby. Ideally, this care should begin soon after conception and continue throughout the pregnancy. The objective of antenatal care are to promote, protect, and maintain the health of the mother during pregnancy, to detect high risk cases and give them special attention, to foresee complications and prevent them, to remove anxiety and dread associated with delivery, to reduce maternal and infant mortality and morbidity, to teach the mother elements of childcare, nutrition, personal hygiene, and environmental sanitation, to sensitize the mother to the need for family planning, including advice to cases seeking medical termination of pregnancy, to attend to the under 5 accompanying the mother. Quality throughout the continue of the care. WHO advises a world where every pregnant woman and newborn receive quality care throughout the pregnancy, childbirth, and the postnatal period, reducing mortality and morbidity, providing respectful care that consider women's views, optimizing service delivery within the health system. Women views. Women want a positive pregnancy experience from ANC, a healthy pregnancy for mother and baby, including preventing or treating risk, illness, and death. Physical and social culture normality during pregnancy, effective transition to positive labor and birth, positive motherhood, including maternal self esteem, competence, and autonomy. Antenatal visit. Visit 1 8 to 12 weeks for first trimester, contact 1 up to 12 weeks, second trimester, visit 2, and the third trimester, visit 3 at 32 weeks, and fourth visit as 36 to 38 weeks. Previously, the four-visit WHO-ANC model involves specific evidence-based intervention for all, carried out at four critical times, also known as the focused antenatal care model, part of pregnancy, childbirth, postpartum, and newborn. Most pregnant women access skilled antenatal care at least once, but globally only 60% receive from antenatal care visit. Pakistan 51%, South Asia. The lowest level of antenatal care are observed in sub-Saharan Africa and South Asia. Percentage of women aged 15 to 49 attended by any provider at least 4 times during their pregnancy. Globally, 87% of pregnant women access the antenatal care and with a skilled health personnel at least once. Less than 3 in 5, 59% receive at least 4 antenatal care visits. In a region with the highest rate of maternal mortality, such as Western and Central Africa and South Asia, even fewer women receive at least 4 antenatal care visits, 53% and 49% respectively. Early pregnancy detection. It facilitates proper planning and allow for adequate care to be provided during pregnancy for both the mother and the fetus. Record the date of the last menstrual period and calculate the expected date of delivery. The health status of the mother can be assessed and by any medical illness that she might be suffering from can be detected also to obtain the and record the baseline information in blood pressure, weight, and hemoglobin, etc. It also helps in timely detection of complication at an early stage and helps to manage them appropriately by referral as and where required. Early detection of pregnancy and provision of care from the initial stage facilitates a good interpersonal relationship between the caregiver and the pregnant woman. Essential component of every antenatal checkup. First one is take the patient history, conduct a physical examination, measure the weight, blood pressure, respiratory rate, and check up for pallor and edema. Conduct abdominal palpitation for fetal growth, fetal lie, oxalate of fetal heart, sound according to the stage of pregnancy. Carry out laboratory investigations such as hemoglobin estimation and urine tests for sugar and proteins. History taken include confirm the pregnancy first visit only, identify whether there were complications during any previous pregnancy, identify any current medical, surgical, or obstetrics condition, record the date of first day of last menstrual period, record symptoms indicating complications such as fever, persistent vomiting, abdominal, vaginal discharge, or bleeding. History of any current systematic illness such as hypertension, diabetes, heart disease, tuberculosis, family history of twins or congenital, history of drug allergies and habits. Physical examination include pallor. Presence of pallor indicate anemia. Pulse. The normal pulse rate is 60 to 90 beats per minute. Respiratory rate. It is important to check the respiratory rate, especially if the woman complain of breathlessness. Edema, which appear in the evening and disappear in the morning after a full night's sleep, could be a normal manifestation of pregnancy. Any edema of the face, hand, abdominal wall, and vulva is abnormal. Blood pressure. Measure the woman's blood pressure at every visit to rule out hypertensive disorder of pregnancy. Hypertension is diagnosed when when two consecutive readings taken from 4 hours or more apart show the systolic blood pressure to be 140 or more and the diastolic pressure to be 90 or more. High blood pressure during pregnancy may signify pregnancy-induced hypertension or chronic hypertension. The presence of albumin plus 2 together with a high blood pressure is sufficient to categorize as her having preeclampsia. Weight. The pregnant woman's weight should be taken at each visit. The weight taken during the first visit registration should be treated as the baseline weight. Normally, a woman should gain 9 to 11 kg during her pregnancy. Ideally, after the first trimester, a pregnant woman gains around 2 kg every month. Abdominal examination include examine the abdomen to monitor the progress of the pregnancy and fetal growth. The abdominal examination include following measurement of fundal height, enlargement of the uterus, and the height of the uterus fundus is shown. 12 weeks pubic bone, 22 weeks towards umbilicus, and 36 weeks xiphisternum. Fetal heart sound. The fetal heart sound can be measured after 6 months. The rate varies between 120 to 140 per minute. They are usually best heard in the midline. After the 28th week, their location may be changed because of the position and lie of the fetus. Fetal movement can be felt by examine after 18 to 22 weeks by gently palpating the abdomen. These can be felt, fetal parts can be felt about the 22 week. After the 28th week, it is possible to distinguish the head, back, and limbs. Multiple pregnancy. This must be suspected if the uterus is large than the estimated gestational age or palpitation of multiple parts. Fetal lie and presentation relevant only after 32 weeks of pregnancy, inspection of abdominal scar, or any other relevant abdominal findings. Assessment of gestation age. Measurement of gestational age has changed over the time. The most accurate gold standard for the assessment is routine early ultrasound assessment together with the fetal movements, ideally in the first semester. Gestational age assessment based on the date of the last menstrual period was previously the most widespread method used and remains the only available method in many settings. Many countries now use best abstract estimate combining the ultrasound and the LMP as an approach to estimate the gestational age. Anomaly scan to detect any unusual development finding is recommended at 18 to 22 weeks. The following laboratory investigations are carried out at the facilities indicated below. At BHU, the pregnancy detection test, hemoglobin examination, blood grouping, including Rh factor, urine test for presence of albumin and sugar, rapid malaria test, dengue and blood sugar test. At RSC, HIV test, rapid malaria test, HB antigen for hepatitis B infection, intervention and counseling, iron and folic acid supplementation, and medication as needed, immunization against tetanus, group or individual instruction on nutrition, family planning, self-care, delivery and parenthood, home visit by a female health worker and trained DAI referral services where necessary. Prenatal advice, diet, reproduction cost, energy. A pregnancy is total during duration consume about 60,000 kilocalorie over and above normal metabolic requirement. Location demand about 550 kilocalories a day. Personal hygiene, personal cleanliness, rest and sleep 8 hours and at least 2 hours rest after midday meals. Constipation should be avoided by regular intake of green leafy vegetable, fruit, and extra fluids. Exercise, light household work is advised, but manual physical labor during late pregnancy may adversely affect the fetus. Smoking, alcohol, dental care, drug must be taken with caution and with advice of doctor. The X-ray examination in pregnancy should be carried out only for few indications. Warning sign: the mother should be given clear-cut instruction that she should report immediately in case of the following warning signs: fits, severe headache, blurring of the vision, severe bleeding or discharge per vagina, persistent vomiting, severe abdominal pain, persistent backache. Specific health protection, anemia, the major etiological factors being iron and folic acid deficiencies. It is well known that the anemia is associated with a high incidence of premature birth, postpartum hemorrhage, puerperal sepsis, and the thromboembolic pneumonia of the phenomena in the mother. Daily oral iron and folic acid supplementation with 30 to 60 mg of elemental iron. Folic acid is recommended for pregnant women to prevent maternal anemia, puerperal sepsis, low birth weight, and the preterm birth. Women already having child with spina bifida must be taken 4 mg folic acid daily. Toxemiosis of pregnancy, the presence of albumin in urine and an increase in blood pressure indicates toxemiosis of pregnancy. Their early detection and management are indicated. Efficient antenatal care minimize the risk of toxemiosis of pregnancy. Tetanus: if the mother was not immunized earlier, 2 doses of absorbed tetanus toxide should be given. The first dose at 16 to 20 weeks and the second dose at 22 24 weeks of the pregnancy. Syphilis screening all pregnant women for syphilis with the oocyte RPR or any other available rapid test on the first antenatal visit. The screening should be done preferably before 16 weeks of gestation to prevent congenital infection, and again in the third trimester. German measles must be considered if there is history of contact of system. Recommended vaccine during pregnancy. CDC recommends that pregnant women get two vaccine during every pregnancy. Flu vaccine. CDC recommend getting the flu vaccine if you are pregnant during flu season. While flu season vary in that their timing, the CDC recommend getting vaccinated by the end of the October if possible. Tdap vaccine. Pregnant women are also encouraged to get the Tdap vaccine at any time during the pregnancy, but optimally between 27 and 36 week of each pregnancy to protect yourself and your baby for pertussis, also known as whooping cough. This vaccine is recommended during every pregnancy, regardless of how long it has been since you previously received the Tdap vaccine. These are the vaccines which are recommended for the pregnant woman. Mental preparation. Antenatal care does not mean only palpation, blood and urine examination, and pelvic measurement. These are no doubt important aspect of antenatal care. Mental preparation is as important as physical or material preparation. Family planning. Family planning is related to every phase of the maternity cycle. The mother is psychologically more receptive to advice on family planning than at other times. Educational and motivational efforts must be initiated during the antenatal period. Advice with pet at homes. It is generally safe to have a cat while you are pregnant too. Like dogs, you must watch out for bites, scratches, and ticks. But with cats, you must be careful about dealing with the cat poop. Cat feces can contain the parasite that cause toxoplasmosis. Recent advances. Implementation of the new WHO antenatal care model for a positive pregnancy experience, a monitoring framework. The new WHO ANC model, e.g., iron and folic acid supplement, ultrasound every 24 weeks, and Hellman treatment, and other recent recommendation, e.g., syphilis testing and counseling on pregnancy danger sign fit into the framework. The model aims to achieve maternal outcome like infection, side effects, and symptomatic relief, fetal neonatal outcomes, preterm birth, congenital abnormalities, and low birth weight test accuracy. Outcome include sensitivity and specificity, and health system outcomes, e.g., ANC coverage and facility-based delivery. These outcome of interest guide guided the development of the new WHO ANC model and provide clarity on what the monitoring frameworks impact domain means for ANC. Factors affecting the utilization of antenatal care among the married women of reproductive age in the rural Thatta, Pakistan, finding from community-based case control study method. A community-based case control study was conducted in district Thatta, Pakistan. Women who did not utilize ANC services during their last pregnancy were considered as cases, while controls were the women who utilized ANC services during their last pregnancy. Question related to socio-demographic access related factor and utilization of ANC were asked from women. Road network distance was calculated from the woman's home to the healthcare facility providing ANC services. Logistic regression analysis was performed. Conclusion: road network distance has no measurable impact on ANC utilization among the married women in Thatta district, Pakistan. Nulliparous woman having knowledge of ANC living in well-constructed house equipped with electricity were found to be utilization utilizer of ANC service. It is recommended that awareness and health education sessions should be arranged for pregnant women in the rural Pakistan. MCQs. Question number one. A lady who is pregnant or considering pregnancy should get a healthy checkup. Which of these vaccines should be up to date before they get pregnant because of the danger of the disease to the fetus? Option A, tetanus. Option B, diphtheria. Option C, measles, mumps, rubella. Option C, D, flu. And E is plague.
Tetanus.
C is the right answer. Question number two. A 21-year-old woman present in OPD for her routine antenatal checkup at 22 weeks gestation. Where would you expect to find the uterine fundus? Option A is at pubis. Option B is umbilicus. Option C is xiphisternum. Option D is halfway between xiphisternus and umbilicus. Option E is below umbilicus. Two.
Umbilicus. B.
Yes, umbilicus. Question number three. A 27-year-old pregnant lady comes to see you. She tell you that her first pregnancy and the last time she saw her menstrual period was 25 weeks ago. What would you normally see on her for the next visit? 26 to 28 weeks. B is 30 to 32 weeks. C is 34 to 36 weeks. D 36 to 38 weeks. And E is 40 weeks. The
30
correct
to 32 weeks. B.
B is the right answer. Question number four. Suppose a young lady comes to you at 32 weeks of her pregnancy. You discover that her blood pressure is 120 by 90. She has mildly pale conjunctiva and fundal height is measured as the 38-week size. What could be the possible reason for this fundal height? Option A is oligohydramnios, preeclampsia. C is twin pregnancy. D is history of smoking in mother, and E is alcohol history. Mm,
C.
C is
C, twin
the
pregnancy.
yes, C is the right answer. Question number five. A 37 weeks pregnant woman attends an antenatal clinic at a primary health center. She has not had any antenatal visit till now. The best approach regarding the tetanus immunization in this case would be option A, give a dose of TT and explain to her that it will not protect the newborn and she should take the second dose after 4 weeks even if she deliver in the meantime. Option B, do not waste the TT vaccine as it would anyhow be of no use in this pregnancy. Option C, give one dose of TT and explain that it will not be useful for pregnancy. D is give her an anti-tetanus immunoglobulin along with the TT vaccine. Give and option E is give 3 dose of TT.
A.
A is the right answer.
A,
Question number six. Healthcare providers advise people to take 400 mg of folic acid daily before they get pregnant and during pregnancy. What can this help prevent in the baby? Option A is respiratory disorder. Option B is disorder. Option C is brain and spinal cord defect. Option D is congenital heart disease. And option E is Down syndrome.
C.
C, C.
Uh, C is the right answer. Question number seven. A disease contracted from a parasite found in cat can cause severe damage to an unborn child if mother become infected. This disease is rubella. B is toxoplasmosis. C is German measles. D is flu and E is plague.
A.
B is the right answer.
B. E.
Question number 8. 35 years old woman who is now in her fifth pregnancy with four alive children presented in the antenatal clinic and diagnosed as a case of anemia. She consumed green leafy vegetable and fruit, but her diet is deficient in meat products. Cause of anemia in her case is option A is folate deficiency, option B is sickle cell anemia, option C is iron deficiency, option D is thalassemia, option E is B12 anemia.
C. Iron
C.
deficiency anemia.
C is the right answer. Question number 9. 19-year-old Primi Gavida comes in emergency at 32 weeks of gestation. She is complaining of blurring of vision, gross edema. On examination, her BP is 170 by 115. What is the most likely diagnosis? Option A is hypertension, option B renal disease, option C eclampsia, option D is preeclampsia, and option E is thyroid disease.
Preeclampsia.
Yes, preeclampsia. 23 years old Primi Gavida present to you at 14 weeks of gestation. She is concerned about normality of fetus. At what time you will advise her detailed fetal anomaly scan? Option A is 22 to 24 weeks. Option B is 14 to 16 weeks. Option C is 18 to 22 weeks. Option D is 10 to 14 weeks. Option E is 24 to 28 weeks.
C.
C is the right answer. This is the key of all the question. Here is the reference through which this presentation has been made. Here is the YouTube link of this presentation. Thank you.